Africa is grappling with a growing mental health crisis driven by economic pressures, climate shocks, unemployment, substance abuse, and the lingering effects of pandemics and conflict. In Zimbabwe, cases of depression, anxiety, and substance-related disorders are steadily rising, placing increased strain on families, communities, and the public health system. In response to this crisis, Africa CDC and the University of Zimbabwe, as well as the Ministry of Health, are hosting a 2-week workshop targeting health workers and other sectors in response to this growing burden. And right now we are joined by one of the trainers to unpack for us what is happening here and how important is this training. Who are we training?
Okay, my name is Dr. Patience Mawunganidze. Here we are training different mental health professionals from all over Africa on mental health, and it is being done under the University of Zimbabwe and Africa CDC. So this training is important because it is going to empower different African professionals in leadership. So it's a course that's going to improve our cadres and in leadership, and is going to enhance and improve service delivery in mental health.
Probably just maybe briefly share with us how deep is the crisis, especially in Zimbabwe, the mental health crisis. What are some of the triggers and maybe the driving factors for mental health, the push factors?
Okay, so in terms of the level of crisis, it's similar globally and in Africa. So what we are seeing in our country is not different from what other countries are seeing, and we know that there are different triggers for mental health, including the fact that you might have a genetic predisposition. You might have been born with the genetic trait that predisposes you to things like depression, anxiety, and schizophrenia. It could be your lifestyle, the things that you are doing or not doing that puts you at risk of developing a mental health condition. Yes.
Thank you so much for that.
Okay, good morning. My name is Dr. Fiona Makoni. I'm the Dean of the Faculty of Medicine and Health Sciences at the University of Zimbabwe. So we are the hosts. The University of Zimbabwe, through our Department of Mental Health, have partnered with Africa CDC to have this training for mental health practitioners, to empower them with leadership skills so that they can, at every level where mental health interfaces with society, they are able to become our collaborators, our ambassadors within the Southern Africa region, and we also have countries that are beyond the Southern Africa region. So it's a 2-week training program really to empower our mental health practitioners with leadership skills in the space of mental health.
Probably just unpack for us how deep is the mental health crisis, and research shows that there's a growing burden and also linked to suicide. How are these two linked?
It is a crisis. It's a crisis not only here in Zimbabwe, but it's a crisis within the Southern Africa region, within the Africa region, and globally. We are all aware, if we live here, that we have a drug and substance abuse crisis that is affecting all sectors of our population, starting with our young, the youth. But other sectors of the adults are also affected, either directly as they themselves being users or abusers, or having to live with people who are abusing and using. So that affects the mental health of the abuser, but also of the people who live with them. Suicide is a growing burden. Even now, as we have people from other countries, I'm sure in our interactions during the training, we're going to hear what is happening in their countries. But here in Zimbabwe, we know it's a growing burden. And I'm with the university, but the Ministry of Health is already shared with us the initiatives they are taking on suicide prevention. And of course, we as the academics are the ones who do the research, who provide the data, and we work together with the Ministry of Health. So mental health is a big burden globally, and we have to be working not only to attend to the issues when they arise in the community, but we need to develop leaders within the mental health space. Yes, and that is what this program is about.
Thank you. So we have heard from the University of Zimbabwe and the Ministry of Health, and we'll be giving you more and other details as the meeting and the training progresses. So for these and other details, join us on our social media platforms.